And now some terms that are not built from word parts, and this is, again, those that are maybe a little bit harder to learn because there's no way of breaking them down into individual parts. So memorizing them is probably your key method. However works for you best in memorizing. I've had students who have written them over and over again until they've gotten them down. So whatever works for you in that case. First one's chronic obstructive pulmonary disease. This is a progressive lung disease where airflow is obstructed, makes it difficult to breathe, um, and they quite often will have chronic bronchitis and emphysema along with it. This is actually a problem that can be created by several different avenues. Very common abbreviation here is COPD, which is chronic obstructive pulmonary disease is your abbreviation, and you hear both of those quite frequently. So both of those are used. Coronavirus disease, we know more about it now, but it is a respiratory infection caused by a virus. It causes fever, cough, fatigue, difficulty breathing. So we know it's a whole progression of signs and symptoms. Cystic fibrosis we know as a hereditary disease that causes excessive mucus production in the respiratory tract, and pancreatic deficiency as some of its key components. Pertussis is a very contagious bacterial infection of the respiratory tract. They'll have hacking cough, and then that's followed by crowing inspiration, or what's referred to as a whoop. And this is very commonly referred to as whooping cough, and we hear that breakouts of whooping cough pretty much every year in some region. Pulmonary embolism is a fluid accumulation in the alveoli and bronchioles. We see this not too infrequently in patients who are in heart failure. Surgical terms include adenoidectomy. Ectomy is going to refer to excision, and adenoid tells us where, so it's a surgical excision of adenoid. Laryngoplasty. Plasty means surgical repair. Larynx is the location, so this is surgical repair of the larynx. Sinusotomy is incision, is otomy. Sinus again is where, so it's an incision into a sinus. Thoracentesis, this is surgical puncture to aspirate fluid, is the centesis, and Thora tells us it is the chest cavity, so that would be the location that we're doing a surgical puncture. Tracheostomy. Ostomy means to create an artificial opening, and in this case it's the trachea, so create an artificial opening in the trachea. In part 2, we'll look at definition, pronunciation, and spelling of diagnostic terms and of complementary terms. We also look at abbreviations and applying the medical language in a clinical form. Looking at endoscopy suffixes. 3 suffixes here that look very similar, but they do have distinctive separation in meanings. A scope is an instrument used to examine. Scopy is the actual visible exam procedure, and scopic is pertaining to the visible exam. Let's look at some diagnostic terms built from word parts. A bronchoscope is an instrument used for visual examination, and broncho is referring to the bronchi. So this is an instrument used for visible examination of the bronchi. Capnometer, we know that meter means an instrument to measure. Capno means carbon dioxide, so this is an instrument used to measure carbon dioxide. Laryngoscopy is a term that means visual examination in oscopy. Laryngo tells us it's the larynx, so this is a visible examination of the larynx. Polysomnography is a process of recording or of testing uh, during sleep, and this is done quite often during when you have a patient that we question they have some sleep obstruction during sleep or where they have sleep apnea. Spirometry is metry is a measurement of, and spiro refers to breathing, so this is a measurement of breathing. Now, those that may be just a little bit more difficult to remember, arterial blood gases are tests that are performed with the use of arterial blood, looking at the levels of oxygen, carbon dioxide, and the pH level of the blood. And ABG is a common abbreviation here in especially laboratory settings. Chest computed tomography or CT scan. CT is a very common abbreviation. It is a computerized X-ray type or radiologic type of image of the chest performed looking at tumors, abscesses, or maybe pleural effusion. Peak flow meter is a portable instrument, and we use that to measure airflow as it's being forced out in exhalation. We see this in, especially with asthma patients, looking at whether or not they need to make adjustments in their medication. Percussion is the act of tapping of the body surface to determine the density of that of the part beneath the sound. So they do tapping, and by the type of sound they hear, tells them again what whether there's a fluid there or what they're actually questioning. PPD is a skin test that is performed on people to see if what their level of exposure to tuberculosis is. The PPD is really referring to purified protein derivative, which is what is used for the testing, and it's injected under the skin and then observed in about 48 hours for the reaction. Okay, let's look at examples of complementary terms that are built from word parts. Dysphonia, we said that DYS prefix is going to mean, one of the meanings is difficult or painful or those kind of definitions. Phonia, we said, was sound or voice, so this is a condition of difficult voice. Hypercapnia, hyper refers to excessiveness. Capnia refers to a condition of carbon dioxide. So this is a condition of excessive carbon dioxide. Hyponia, nia refers to breathing. Hypo refers to deficient, so this is deficient breathing. Hypoxemia, emia refers to blood. Hypo refers to deficient again. And oxy refers to oxygen, so this is deficient oxygen level in the blood. And rhinorrhea, rhea, it refers to discharge. Rhino means nose, so this is a discharge of the nose. And if you want to look at this from a simplified form, it would be running of the nose for some reason. Now we'll look at those that are not built from word parts. A bronchodilator is an agent causing bronchi to widen, and this is most commonly a medication used to widen the bronchial passages so a patient can breathe better. Mucopurulent means that it contains both mucus and pus. A nebulizer is a device that creates a mist that is used along with medication to give a patient respiratory treatment. And we see this again on patients who have lung disease or asthma. We see those used fairly frequently. Bronchi is a low-pitched or with kind of a snorting-like sound that's heard with a stethoscope, and the consideration here is when hearing this that typically is going to mean that there's secretions in the airway. Wheeze is a whistling sound, high pitched, and again, it's caused with airflow through narrow airways. We see it again most commonly in asthma, chronic bronchitis type situations. There's several abbreviations in this chapter that are used somewhat frequently. We're going to look at only 5 of those at this point, but ARDS or ARDS means acute respiratory distress syndrome. HAP means hospital-acquired pneumonia, and LUL or LUL. This is a directional term. This means left upper lobe. SOB is a very common abbreviation used in healthcare to mean shortness of breath. And VBG means venous blood gases. And now we'll look at a clinical application of using some of the terms as you might see them in an actual clinical report. I do encourage you to read the terms even out loud as we're going through them, because it's a whole lot different to read them out loud than it is to read them and think them. It's not the same process. A 24-year-old man visited the emergency department because of dyspnea, hyperpnea, and paroxysm of cough and producing thick, tenacious mucus. He had a history of asthma since the age of 12 years. A chest radiograph was negative for pneumonia. Arterial blood gas showed hypoxemia, but no hypercapnia. Pulmonary function test disclosed bronchoconstriction, which was corrected by a bronchodilator. A nebulizer was prescribed for treatment. The asthma attack was probably precipitated by an episode of bronchitis.